His skin was blue. Not bruised. Not pale. Not the dusky blue of a man who could not breathe. Metallic blue. The color of a tarnished coin under fluorescent light. When the receptionist saw him walk in, she thought it was a costume. The nurse who took his vitals could not stop staring. By the time the dermatologist entered the room, every staff member in the clinic had found a reason to walk past the open door. His name was Paul Karason. He was 57 years old. He lived in Madera, California. And he had done this to himself, on purpose, over the course of 14 years. His blood pressure was normal. His oxygen saturation was 98%. His heart was beating at 72 beats per minute. By every measurable standard, he was a healthy middle-aged man. Except he was the color of an old key. Nobody could have predicted what happened next. Because nobody, including Paul himself, knew that the transformation could not be reversed. Paul Karason had been an ordinary man for most of his life. He was born in 1950 in Bellingham, Washington. He worked a variety of trades. He had a family. He had health concerns common to men in their late 30s. In particular, he had developed dermatitis on his face, a stubborn skin condition that caused redness, irritation, and discomfort. Conventional treatments had not given him lasting relief. In the early 1990s, like millions of Americans turning toward what was being called alternative medicine, Paul began reading. He found an article in a health magazine that promised a near-miraculous treatment. The article described colloidal silver, a suspension of microscopic silver particles in distilled water. The claims were extraordinary. According to the article, colloidal silver could kill any bacteria, any virus, any fungus. It could heal the gut. It could repair the skin. It was, in the words of its advocates, a natural antibiotic the pharmaceutical industry did not want you to know about. Paul was convinced. He bought a small machine that allowed him to make colloidal silver at home. 2 silver rods. A battery. A glass of distilled water. Run a small electrical current through the rods, and silver ions leached into the water. He drank a glass every day. When his dermatitis did not improve fast enough, he upped the dose. He drank more. He also began applying the silver solution directly to the skin on his face. And then, somewhere around the year 2000, he began to notice it. At first, it was just a faint grayness around his eyes. He thought he was tired. The grayness spread to his temples. Then to his forehead. Then to his cheeks. He did not panic. He told himself it was age. Or lighting. Or his imagination. His wife saw it differently. She told him he looked strange. Friends began to comment. Strangers stared. The grayness deepened. It became a tint. The tint became a color. The color became blue. By 2007, his face was the color of denim. His arms followed. Then his chest. Then his torso. He was not in pain. He felt fine. His blood work was normal. But every mirror in his house was now showing him a man he did not recognize. He lost jobs. He was asked to leave restaurants. People crossed the street to avoid him. He withdrew from public life and lived quietly with his family in Central California. That year, an old friend reconnected with him and was shocked by his appearance. The friend persuaded him to seek medical evaluation. The local physicians had read about his condition in dermatology textbooks. None of them had ever seen a live case. It was supposed to be a relic of the early 20th century. The condition had a name. Argyria. In the late 1800s and early 1900s, before the discovery of modern antibiotics, silver compounds had been used in medicine. Silver nitrate drops were placed in the eyes of newborns to prevent infection. Silver dressings were used on burns. Silver salts were prescribed for ulcers and infections. After the advent of penicillin in the 1940s, silver largely fell out of mainstream clinical use. By the 1970s, doctors essentially stopped seeing Argyria. The condition vanished from clinical practice. It survived only in textbook photographs. Now it was sitting in a waiting room in California, reading a magazine. We are halfway through this case. And the part nobody wants to hear is still coming. The diagnosis was clinical. The blue color of his skin was the diagnosis. But for confirmation, a small skin biopsy was taken. Under the microscope, the answer was unmistakable. Throughout the dermis, the deeper layer of his skin, were tiny black granules, particles of silver, deposited in the connective tissue, bound to elastic fibers, embedded in the walls of small blood vessels. The silver had not stayed in his blood. It had not been excreted in his urine. It had migrated, gradually, into his skin. And once there, it had stayed. The mechanism is straightforward and merciless. When silver ions enter the body, they are absorbed through the digestive tract. They circulate in the blood. The body cannot metabolize them. It cannot break them down. It cannot easily excrete them. When the silver ions reach the upper layers of skin, they encounter sunlight. They undergo a chemical reaction similar to the one that creates a black and white photograph. The silver is reduced. It becomes a stable, metallic deposit. The skin, in effect, becomes a photograph of itself. The more sun exposure, the darker the result. Paul's face, arms, and neck, the sun-exposed parts of his body, were the darkest. The skin under his clothing was lighter. But everywhere, the silver was there. Permanently. The visible color is the work of an optical phenomenon called the Tyndall effect. The same effect that makes pale veins look blue under skin even though the blood inside them is red. Tiny dark particles, viewed through translucent tissue, scatter and absorb light. The human eye reads the effect as a slate gray or deep blue. There is no treatment for Argyria. None. No medication removes silver from the dermis. No cream lightens the discoloration. Chelation therapy, which is used to remove other heavy metals like lead or mercury from the body, does not work for silver in this form. Laser treatments have been attempted with limited and inconsistent results. Paul tried nothing aggressive. He was told he would be blue for the rest of his life. The dose required to cause Argyria is still studied. The Environmental Protection Agency in the United States set a reference dose for silver intake at 5 micrograms per kilogram of body weight per day. Paul had been ingesting amounts vastly higher than that, every day, for years. Some estimates put his daily silver intake well into the milligrams. His liver was fine. His kidneys were fine. His brain was fine. His skin was a permanent record of a decision he could not undo. In 2008, Paul Karason became internationally famous. He appeared on the NBC Today show in an interview with Matt Lauer. Newspapers around the world picked up the story. The internet gave him a nickname he did not like. Papa Smurf. He used his sudden visibility to speak honestly. He acknowledged that he had used colloidal silver in quantities far beyond what most labels recommended. He acknowledged that he had never consulted a physician. He warned others not to repeat what he had done, but he also continued, by his own account, to believe that the silver had helped him with other health problems. He kept taking it, in smaller doses, until the end of his life. Paul Karason died on September 23, 2013. He was 62 years old. The cause of death was complications from a heart attack and a severe stroke. His treating physicians did not identify silver toxicity as the direct cause. His underlying cardiovascular disease was consistent with conditions common in men of his age. But the visible record of what silver had done to him outlived him. The photographs remain. The case continues to appear in medical textbooks and toxicology reviews. Colloidal silver is still sold in the United States. The Food and Drug Administration ruled in 1999 that over-the-counter silver products could not be marketed for treating any disease. But the products themselves remain legal as dietary supplements. New cases of Argyria appear in medical literature every year. Most are mild. Some are severe. A few patients have permanently blue gums, blue fingernails, blue eyes. All of them are documented. All of them are preventable. The lesson of Paul Karason is not that silver is uniquely dangerous. It is that the human body has limits. When a substance cannot be excreted, it accumulates. When it accumulates in skin, it stains. When the stain is metallic, no medicine on earth can wash it out. Next case. A woman who remembers every day of her life in perfect, ungovernable detail. Every meal. Every argument. Every loss. She cannot forget. She cannot turn it off, and what she calls a curse turned out to be one of the rarest neurological conditions ever recorded.